Hello, everybody. So our group chose the adaptation theory. The adaptation theory was created by Sister Callista Roy. She was born in 1939 in Los Angeles. Something that I found really interesting is that she worked as a staff nurse and in an administrative position at St. Mary's Hospital right here in Tucson, Arizona. She created the adaptation theory in 1976, and this model of nursing asks three central questions, which are: who is the focus of nursing care? What is the target of nursing care? And when is nursing care indicated? So this theory is a little special to me because it looks at nursing care from a holistic perspective. So what is the adaptation theory? Well, this theory discusses that all living things adapt to their environment. So humans in general all adapt to their environment, whether they become sick or they are exposed to stress or just different aspects of their lives depending on nutrition and family and social relationships. Everybody adapts to their environment. So this theory takes a holistic approach because it doesn't just look at illness and disease by itself and just treating that specific problem. It looks at all the different aspects and everything that patient or human is forced to adapt to. So the goal is to promote adaptation through illness and disease by, as we just discussed, treating the illness, but also helping that patient adapt through that illness and disease and adapt to their environment and overcome the issues that they're involved in. So as previously discussed, it asks three central questions, which are, again, who is the focus of nursing care? What is the target of nursing care? And when is nursing indicated? And a quote right there from Callista Roy is, individuals are in constant interaction with a changing environment. So even if a patient is not directly exposed to a disease or an illness, they are still forced to adapt to their environment and each situation they're involved in, which really brings out the holistic approach because there are some things that we can't prevent with vaccines and preventative care, but it's all about helping the patient adapt to their environment. So all of the nursing theories can be categorized differently, and they are categorized to how complex each therapy is. So a conceptual model is organizing structure that defines the theory. And the adaptation theory is a grand theory, which makes it one of the more complex theories. Grand theories have extensive scopes that also include universal scopes, which means that they are the most complex theories and they involve many different parts. These theories have been described as complicated and abstract and are much harder to understand than the more basic theories. So a meta-paradigm, I cannot say that word. That is what is composed of a couple different elements such as person, environment, health, and nursing, and they can be common to a lot of different theories. So the first part refers to person, which would be the patient or their family or their community or the group, and they are the person who is receiving the nursing care. The next section is environment, and that is the different stimuli that impact behavior and their ability to adapt. So it can include external and internal things that affect that person. The next section is health, which is the outcome or output of adaptation. So meaning how that stimuli affects the person and how they adapt and overcome that or they don't. It equivalates to their well-being. The last section is the goal of nursing, which is where we try to combine all the pieces together and help that person adapt and overcome from what they're being exposed to. It uses, as the quote says, utilizes the 4 modes to promote health and integration between the adaptation for all patients. So our first evidence-based practice example would be a patient who is a 34-year-old female preschool teacher who was diagnosed with breast cancer 1 month ago and has just recently begun chemo treatments. She has a 2-year-old daughter with her husband. So the first part we look at is the physiological, which would be like oxygenation, nutrition, elimination, activity and rest, protection. So going into some detail with that, nutrition, trying to create a balanced diet for the patient since they are seeing the effects of chemo and having a lot of nausea and vomiting, which is affecting their nutrition. Some other areas are like the fluid and electrolyte and acid-base balance with the vomiting and nausea and stuff. The next section is going to be the self-concept mode, which has to do with the patient's positive body image, how this affects her mentally and emotionally, trying to regain sexual function with dealing with the emotional and mental aspects of going through chemo and the side effects that are associated with that. The next section would be role function, which could change that person's identification of their roles, and that would also include how that person is coping and how the patient is coping with having chemo and having cancer and how she views herself as a woman. She would obviously have issues trying to balance her love for herself and her emotional and mental well-being. So we talk about that as well. And then also the interdependence. So this patient may have issues caring for themselves, caring for their child. So this theory relates to all of those different aspects because we don't just treat the breast cancer or the side effects. We have to treat the patient holistically. For our next case study, we have a patient who is a 13-year-old female, and she was diagnosed with diabetes as a toddler, but now she is struggling with elevated blood glucose levels over the last couple months. Her levels are above the recommended level to prevent diabetes complications. So the physiological aspect would be to treat her higher and elevated blood glucose levels with administering insulin and talking to her about diet to help her better control that. The self-concept version of that is that she's a 13-year-old child who is turning into a woman, and she's trying to adapt to her body and understand her surroundings, and she has all of the added stress that comes with everything with being a teenager. That also leads into role function, to where she's trying to learn how to take care of herself and trying to merge from being a child and more of an adult, but she's struggling with that, which also leads to the interdependence of trying to be able to take care of herself and learn how to be an adult and manage her illness. So again, this adaptation theory helps with multiple different areas, between treating the symptoms and treating the illness itself, with also treating the patient holistically and helping her become interdependent as an adult and manage those on her own. The next evidence-based practice example is a patient who is a 24-year-old male who began drinking excessively and became more and more depressed, which led him to mixing narcotics and alcohol together. His narcotic use has turned into using nasal heroin. He lost his relationship with his girlfriend and was close to being fired from his job for increased absences. He was also admitted to the emergency room for the second drug overdose that year. So the physiological aspects of this case would be treating the withdrawal symptoms and helping him manage his symptoms without having any added side effects such as seizures and other complications from the withdrawal. But then we also have to treat the self-concept aspect, to where we need to help him get over the underlying issue as to why he's using narcotics and alcohol to self-soothe and treat the symptoms he's dealing with. We also have to help this patient with his role function, because he's trying to work at his job and maintain that, as well as overcome the obstacles with losing his relationship and the toll that his addiction has taken on him. So we also have to treat his interdependence by giving him that autonomy and helping him succeed in all areas, as opposed to just treating the physiological symptoms. We have to help him altogether so he doesn't turn back to these addictive tendencies in the future. And these are our references that we used for our PowerPoints. Each one of those case studies is documented here in the references. Thanks.